Okay, I'm going to go ahead and demonstrate some surface anatomy, and I'm going to draw it out. Basically, what I'm going to look for the most prominent aspects of the dorsal spine. And so on either side, you have the posterior superior iliac spine, the PSISs. And so what I'm going to do is I'm going to follow the iliac crest around, and then I'm going to follow it around, and then I'm going to be on the medial aspect of the PSIS. And then I'm going to find the caudalmost aspect of the PSIS. And this is going to be really helpful for me trying to identify the spinous processes. So I'm going to go ahead and draw that out. And there's the medial edge of the PSIS there. And there is the caudalmost aspect of the PSIS on the right. It's medial. And then I'm going to do the same thing with the iliac crest on the left. And I can follow it around. There's the medial aspect. So I'm going to go ahead. There is the crest. And it's coming around. And here is the medial aspect, the posterior superior iliac spine, PSIS. And there's the inferior border. And so this on my patients is the most easily palpable bony structure on the dorsal aspect of the spine, and I can appreciate the width of the PSIS. So there's the width of the left, and here is the width of the right PSIS. And so what I like to do is I can draw a helper's line between these lower borders of the PSIS, and this is going to help me locate the level of S2. So that little X right there is the level of S2. And so if I can take my finger up about one finger's width, I can find the spinous process of S1. And this is a lot of variability individually. Some people have a more prominent spinous processes in the sacral spine, some don't. But this is going to be, so again, the level of S2 at the lower border of the PSIS is there, and then if I go up, that'll give me S1. And then the other area that I want to look for, and this is going to be important when I go into my mobilization techniques, is this is the cranial aspect of the sacrum, and if I go just cranial to that, I will find the lower border of the L5 spinous process. And so what I'll do is I'll start with S2 at the lower border of the PSISs, go up one finger width to S1, and then immediately following that I can find the lower border of the L5 spinous process. And what I'm going to do is I'm just going to come out here into the soft tissue and palpate medially and feel for the inner spinous space between L4 and L5. So here's the L5 spinous process, a little bit rounder than, a little bit smaller and rounder than L5. I'm sorry, than L4. And then I can come up and I can palpate L4. And what I'm doing is I'm just coming up along the lateral aspect of the spinous processes, and I'm palpating for the interspinous space. So here is L4. The interspinous space between L4 and L3 is right there, and I'm going to draw a little line there. There's L4, and I can continue on up. Interspinous space between L3 and L2 is right here, and I can trace out L3. So here's L3, L4, L5, and I can continue up. Here is L2. And what I'm going to do is I'm going to use the location of these interspinous spaces when I go in and perform my mobilization techniques. I demonstrated the surface anatomy in prone because this is an easier position. It brings out, makes these spinous processes a little bit more easier to palpate. I can also locate the PSIS. So the steps that I use for localizing my mobilization techniques. And what I'm going to demonstrate is going to be L5, S1, and then a technique for L4, L4, L5. And so the technique that I used was locating the lower border of the PSISs, which is corresponds with the S2 spinous process. I can go up one finger width. There is the S1 spinous process, and then immediately above that is the interspinous space here between L5 and the cranial border of the sacrum. And then I can follow it up for the other interspinous spaces. Interspinous space between L5 and L4, interspinous space between L4 and L3, interspinous space between L3 and L2. And so that's what I'm going to do when I have him roll over onto his side and perform the sideline mobilization techniques.